Yeah, Smriti, we are good to go.
All right, shall I start, Yogi?
Smriti, you can start.
All right. So a very good evening to one and all present here. I would like to welcome everyone joining us live to this webinar on social prescribing, organized jointly by the IPASF and the IPA Community Pharmacy Division. A warm welcome to those listening to us afterwards, and I would also like to welcome our guest today, whom I'll shortly introduce. I am Smriti Adhikari. Okay, so before getting started with the webinar, I would first like to discuss a few housekeeping rules. That is, keep your microphones muted. If you have any questions, you can feel free to ask us in the chat box. And if you have not become, and if you're not a member of IPA yet, do not worry, we got your back. You can register yourself as a member of Team IPA by clicking on the link below, and we will be dropping the link in the chat box. So, a very good evening to one and all present here. I am Smriti Adhikari, the Secretary of Team IPASF. I did my B.Pharm from Himalayan Pharmacy of Institute, Sikkim, and I'm currently pursuing Masters from Krupanidhi College of Pharmacy in Bangalore. Now, for a sort of a little appetizer, I would like to tell you something about Indian Pharmaceutical Association. The Indian Pharmaceutical Association was established in the year 1939 in Banaras Hindu University. It is the oldest premier association of pharmaceutical professionals in India. It operates in India through 20 different state branches and more than 46 local branches. The IPA works to meet India's healthcare needs, and it is a non-governmental organization that has been in official relations with the FIP and WHO. The IPA is a member of Drug Technical Advisory Board, DTAB, Ministry of Health and Family Welfare, along with the Government of India. Now, I would like to tell you all something about the Indian Pharmaceutical Association Students Forum. IPASF is the student wing of the IPA, established in the year 2008 under the able mentorship of Dr. APJ Abdul Kalam. Indian Pharmaceutical Association created a division in 1996 to make pharmacists aware of their role in the community. IPA Community Pharmacy Division, IPACPD, aims to enhance the role of pharmacists and raise professional standards of pharmacy practice through its activities and aims to improve the public health through the community pharmacy services. All right, it's a great pleasure for me to introduce our speaker for today, Mr. Arun Nadarasa. Arun Nadarasa is the founder of Social Prescribing Pharmacy Association. He is the only pharmacy ambassador for Personalised Care Institute, PCI. He created the first online course for social prescribing for community pharmacy, which has over 830 students from 76 countries via Udemy. He is the only pharmacist as social prescribing champion for the Social Prescribing Champion program established by the National Academy for Social Prescribing and NHS England and NHS Improvement. His passion for social prescribing came from his background as a dance for Parkinson's and medical NLP practitioner. He is also the author of Pharmacy Movement, How to Prescribe Social and Digital Medicines, which is the first published book on the topic of Pharmacy Social Prescribing. He is also the organizer of the world's first Pharmacy Social Prescribing Conference. His articles were published in the Pharmaceutical Journal, Pharmacy Business, and the International Pharmacy Journal. It's a great pleasure for me to introduce our speaker today, Mr. Arun Nadarasa, and who is also going to talk to us about 4 important things. That is, to learn about the social prescribing principles, to understand the blue ocean of pharmacy social prescribing, to evaluate the synergy with the UN SDG 3, and to develop a futuristic mindset on the year 2122. Yes, you heard it right, it's 100 years from now. It's a great pleasure to have you with us, sir, and I would like to give you the floor.
Thank you so much, Smriti, for the very powerful introduction.
Yes, so
thanks again for you, Yogi, for inviting me to the presentation for the Indian pharmacist. So I'm going to share my screen now. Can one see my screen? Yeah, can anyone see my screen?
We can see that.
Yes, yes.
Yeah. Okay. Lisa. Okay, so first of all, thanks again for the opportunity. So today I'll be discussing about what is social prescribing, its principle, and then agenda for today is I'll be discussing about the problem statement. Well, in regard to the personalized care, social prescribing technology, the synergy with the United Nations Sustainable Development Goal 3, and then with the Q&A session. So first of all, before we tackle the topic of social prescribing, we need to understand what is the wider determinant of health. So for instance, I'm going to leave you with this powerful statement from Professor Sir Michael Marmot, where in his book he states, why you treat people and send them back to the condition that made them sick. So for instance, if I was to use UK as an example, we may get a patient coming to the community pharmacy regularly for some cough mixture, right? So we will sell them, for instance, guanfacine for the productive cough. But then another thing to consider is if that person comes to the pharmacy regularly, at some point you want to ask yourself, why is that person always suffering from a chesty cough? And actually, if you were to take the time to go to the patient house, you find out that a person has broken windows, and which is causing the patient to feel cold more often because in UK it's very cold, unlike India. And that's why they get hypothermia and then recurrent chest infection, followed by, of course, chesty cough. So in a nutshell, we need to be shifting of our attention from treating the symptom to actually treating the root cause of the condition. And that's why social prescribing play a big part into this scheme. So in terms of what is exactly the social determinant of health? So for instance, it's been found out from a study done in 2015, over 20% of GP appointments were spent on non-medical reason. So for instance, the top three were relationship, housing, and work related. So if I was to put that into context, in UK, every community pharmacy are within 20 minutes walk from the patient house, and the patient do not need an appointment to speak to a highly trained healthcare professional for medical advice. But if that same patient wanted to speak to a doctor, they probably wait maybe 2-3 weeks, and it would cost the NHS about £20, which is about 2,000 rupees, Indian rupees, costing to the NHS, which is the healthcare system in England. And if that person was to be admitted into the A&E, the hospital, that would cost about £100, which is about 10,000 rupees. So in a nutshell, social determinant of health are any non-medical factors that can influence the health outcome for that specific person. So for instance, it can include housing, education, sanitation, overcrowding, unemployment, and also not being able to speak the local languages and dyslexia. So for instance, in England, especially London, there's a multicultural diversity in different people. So you have people from different countries, and language barrier is a big problem. And recently, there's been a new determinant of health being digital illiteracy, right? So basically, in UK, if you were to look at the patient medical record, it will only state the latest vaccination status, like if they had COVID-19 vaccine, the flu vaccine, if they had any trial vaccine done to them, or any recurrent medication that they take for diabetes, asthma, or potentially acute medication like antibiotic. But in that piece of medical record, you wouldn't necessarily see anything regarding their current financial situation, their current relationship status, if they had recent family member passed away due to COVID-19. Those are information not in the medical record, which can impact into the health and well-being of the patient. So I highly recommend everyone that's watching here today that if you want to learn more about social prescribing, is to really digest those 4 documents written by Professor Marmot, where he did first a report in 2008 in collaboration with the WHO in regard to the social determinant of health. He then did a report specifically focused with the UK population, and then released a 10-year forward view to look on the improvement made since the report in 2010, as well as a 2013 document that was done in collaboration with the European countries. So in terms of the NHS long-term plan, which is geared specifically toward improvement of health and well-being, there is a very clear, concise definition of social prescribing, which I think is the best one out there at the moment, defined by the National Academy for Social Prescribing, which state that social prescribing is supporting people via social prescribing link worker to make community connection and discover new opportunity, building on individual strength and preference to improve health and well-being. Then you may say to me afterward, okay, Arun, that's a very good definition about what is a link worker. And actually, link worker is a role that was pioneered by the voluntary sector, and it was agreed at the UK level that the key skill required for a link worker was active listening, empathy, and supporting people to develop a personalized care plan based on what matters to them, right? And they're responsible for reducing health inequality, and they normally have 6 to 12 contacts across a 3-month period, which can last half an hour to an hour. And often the first session can be up to 3.5 hours because they really want to build a rapport with the patient to really find out what are the passion, what they hope to achieve in their life, if they have any goal to achieve. Because if you were to put in perspective of a doctor, in UK, doctors only have 10 minutes per consultation. So meaning they have to talk to the patient, find out what the problem are, find a diagnosis, and then give a treatment pathway in less than 10 minutes. And if the patient was to go and see them and say, hi, Mr. Dr. Smith, I recently broke up with my girlfriend. What do you recommend? The doctors are expert in medicine and diagnosis, but they're potentially not the best person to discuss about a relationship. And that's where the social prescribing link worker referral comes into play. And at the moment, the link worker cap is about 250 referral per year. And in Singapore, which is an emerging country for social prescribing, instead of calling them link worker, they call them well-being coordinator. So in a nutshell, social prescribing is not signposting. So for example, if the patient come into my pharmacy and say, I love dance classes, do you know anything? And I say, oh yes, there's a dance classes down the road. That's called active signposting. That is not social prescribing. Social prescribing is so much more. It encompasses physical activity, diet and nutrition, housing support, debt advice, gambling addiction support. So in a nutshell, pharmacists in UK are ideally placed to offer health and well-being advice, but the debt and housing support is often missed because we're not trained to cover those topics. And I wouldn't recommend any pharmacist to give legal advice because that could be outside the competence. But the link worker can create a personalized care plan to refer that patient to the appropriate organization. So in a nutshell, social prescribing can help with supporting the finance, being more active, the mental well-being of the patient, becoming healthier, and definitely being more socially connected. So one of the shocking statistics that I found out, I believe 5 years back, was that a patient that is living on their own is the equivalent of smoking 15 cigarettes a day, which is a shocking statistic. So that's why I made it my mission down then that I wanted to raise the awareness of social prescribing in trying to reduce social isolation and improving social connectedness for those senior citizens that had one of the spouse passed away due to old age. So the reason why social prescribing is such a powerful concept, it dates back to the Marsh Law hierarchy of needs, which was created back in the 1940s by a psychologist, where it talks about 5 different stages to achieve the full health outcome maximum stage. So if you look at the bottom 2, the bottom 2 cover more like the external factor. So for instance, personal security, employment, resources, health, property, and then clean water, clean food, clean air, shelters. So in UK, those 2 tend to be covered by the UK government. But then if you look at the top 3, that's more like internal situation, friendship, respect, self-esteem. So you wouldn't go to see a doctor and say, can you prescribe me something to make me more self-actualized with my life? That's outside the scope of a doctor. But social prescribing can help with the top 3, potentially with the bottom 2, depending on the level of need for the patient. And of course, what I'm discussing today is mainly for UK, but you can adapt the main core message for the Indian health system. So in UK, the link worker model is a 6 roadmap, like a piece of a pie, but the most important one that I want everyone to focus on is the orange one, which is create a personalized care plan. So in a nutshell, is shifting the conversation from what's the matter with you, as in what's wrong with you, to what matters to you. How can we help you have a more fulfilling life, right? And it's been shown across 3 studies done by universities that there's been a clear reduction in A&E attendance and GP visit. And it's been shown across that there's been nearly 500,000 million pounds saved. And I think that's like 0.5 lakhs. And it's been, I think it's 0.5 lakhs, if I remember out of my head. So basically, it's a huge saving for the government in getting people referred to a link worker. So as part of the NHS long-term plan, it's been shown that they wanted to have at least 1,000 link workers, which they have achieved that milestone. And they want at least 1 million people benefiting from a social prescribing referral by the end of 2023, 2024. And at least 2.5 million citizens benefiting from a Personalised Care Institute. And at that end, there's been the creation of a Personalised Care Institute, which is enabling healthcare professionals to access high-level e-learning to educate themselves on social prescribing, on personalized care, and shared decision-making. And also there's been the formation of an association specifically for link worker to share best practices, which is something that could be potentially replicated in India. So for example, it could be the Indian National Association of Link Worker or the Indian Association of Link Worker. So in terms of the universal personalized care model, it's been shown that 100% of the population are eligible for a social prescribing referral. So that means if anyone has any kind of unmet needs, they can refer themselves to a link worker. That option is available to them. But then you have the 5% one, which is the one that I really want to emphasize on, is the personalized health budget, personal health budget, or PHB. And basically a PHB is a set of money given to patients with complex needs, which can help them attend cooking classes, dancing classes for the cost of attending the class, as well as transport. And I believe they receive, I think, £90 per week, which is about 9,000 rupees, if my memory serves me right. And in terms of social prescribing funding, it's been shown that NASP, which is the National Academy for Social Prescribing, which is a registered charity in UK, and when it was launched, they received £5 million from the UK government to get it done. So that'd be 50 lakhs rupee by the government to streamline and optimize social prescribing pilot in UK. And they funded 18 lakhs rupee to 37 social prescribing pilot and project in UK alone. And each organization received up to £50,000, which is about 0.5 lakh rupee. And it was involved in increasing the quality of social prescribing referral and enhancing the quality of dance classes, for example, like community asset. So for those that are not familiar with the term community asset is basically anything within a city which can contribute in the health and well-being of the patient. So that could be dance classes, cooking classes, gym, financial advice organization, or even housing advice organization. Then we have the next blockbuster social drug. So for those that are not familiar with the term blockbuster, basically a blockbuster drug is defined in a pharmaceutical company, a drug that generates at least $1 billion in revenue in a single year, right? And in that end, it's been shown that there is this company called PAPA, where they've been valuated as having up to 1.4 billion in valuation. And basically all they do is quite similar to social prescribing, whereby in America, of course, everything needs to be paid by the consumer, by the patient. And PAPA, what they do, they enable for a senior citizen, which is their target market, to have a PAL, which is the equivalent of a link worker, to help them have discussion with, to help them with cooking, to help them head the grocery, and purely in that business model, because in the core of the business model, they incorporate social determinant of health into the business development of their businesses. That's what enabled them to be evaluated at the $1 billion cost. And it's only been launched in 2017. So there is a huge opportunity for the Indian health system or Indian health entrepreneur to try to bring that kind of business model to the Indian health system, right? So that's what I mean by the next blockbuster social drug, where the social drug is trying to alleviate social isolation. Then you have social prescribing technology. So I want to make it clear that in UK, there are several different social prescribing technology provider, but one of my personal favorite is Elemental Software. And basically, the latest metric was that since the launch in 2016, they've enabled up to 150,000 benefiting from a social prescribing referral, helping at least 16,000 healthcare professional and healthcare worker to be involved in the management of a patient from a link worker referral, and at least 200,000 session attended, right? So now I'm discussing about the GSPA. So in a nutshell, the GSPA is the Global Social Prescribing Alliance, which is being created in relation to the United Nations SDG, right? So that was launched back in 2015, and I want the focus on number 3 and number 11. So good health and well-being, ensure healthy lives and promote well-being for all at all ages. So in a nutshell, last year, there's been the pioneering event organized by the WHO at the United Nations HQ in Geneva, where they invited stakeholders globally involved in social prescribing to go and talk about their project. And I highly recommend everyone to watch this video, which is available on YouTube, which really give a concise understanding of why social prescribing is such a powerful tool to alleviate health inequality across the globe. And also from the WHO report, with the current model of care, if things remain the same as it is now, there's going to be a shortage of at least 18 million healthcare workers by 2030, meaning the current model of care, which is focused specifically on reactive approach, as in if a person become unwell, we provide them treatment, needs to shift to proactive approach to prevent people from becoming sick in the first place. And to follow up on that, I'm quite pleased that the GSPA stakeholders were able to present the work of social prescribing at the G20 last year. So for those that are not familiar with the G20, G20 is basically a meeting with all world leaders, so presidents from different European countries coming together to discuss on important topic. And Gad Prech and James Sanderson were able to talk about social prescribing benefit in improving the health and well-being and to create new and meaningful jobs as part of SDG, United Nations. So there's a very good booklet, which I highly recommend everyone to check it out, which is the Good Health and Well-Being Social Prescribing Playbook. And the one I want everyone to focus on is number 2, which is delivering clinical leadership through the development of a global network of clinical champions. And I strongly believe that pharmacists, Indian pharmacists, can be clinical champion to promote the delivery of social prescribing initiative in your city or in the area in which you work on. And another thing to focus on is SDG cities. So I've talked about the pharmacist, I've talked about the pharmacy, but then there's a step above that, which you can think of it at the macro level, which is the SDG city. And in the report, it's been shown that social prescribing can be helpful in involving SDG acceleration to promote health and well-being. So I strongly believe that there be the development of new pharmacist role at CT planning. So think of it as the new role creation of a urban planning pharmacist to help at creating resources in a city to make it geared toward improvement of health and well-being of the citizen and reducing health inequality. So you may ask to me, okay, how popular is social prescribing? Like how mainstream is it globally? So first of all, social prescribing is gaining international recognition, where there's been studies done, for example, in South Korea, in Japan, in Canada, and in India by Determinant, and then in France, in Sweden, Portugal, Australia, and of course, America. And the last one that I really want to emphasize on is definitely Singapore. And I strongly believe that since Singapore is near India, there could be collaborative work done between the two countries to exchange best practice. Because I gave a talk to the Pharmaceutical Society of Singapore back in February, and there were about 212 pharmacists that attended, and they were quite keen to get started on that. So I think there could be a lot of synergy between the Indian Pharmaceutical Association and the Pharmaceutical Society of Singapore to work together to make pharmacy social prescribing more mainstream. So now I'm going to discuss about the Pharmacist Rule in TIS. So in a nutshell, I'm the founder of the Social Prescribing Pharmacy Association, which I launched back in November 2019. And as part of that, I created a development goal to achieve before 2030. So for TIS, I actually created an online course, which is totally free, available on Udemy, in partnership with Dr. Mary-Ann Essam, who's a GP with over 33 years of experience in social prescribing. And as of now, the latest statistic is 880 students from 78 countries, and India has the highest number of enrolled students. So that's why I'm so happy to be here today. And also on top of that, there is an online course available offered by the Personalised Care Institute, where they offer free learning for anyone involved in the treatment of a person, of a patient. So Indian pharmacists can register on the website to upskill your knowledge on social prescribing, personalized care and shared decision making. So link worker. So it is so important that pharmacists collaborate with link worker. So if you were to start drawing the line that pharmacist, a healthcare professional, and link worker, a healthcare worker, you're already creating a fragmentation, and then you're already preparing yourself for defeat. So what I mean by that, you need to be able to shift your mindset that everyone involved in the care of a patient is on the same level. We have to work together as a team, as a team. Therefore, working with link worker, listening to their concern, listening to their feedback is extremely important to make social prescribing a success. So for example, in the UK, there is the social prescribing qualification created by the Bromley Bible Center. And you could develop something similar in India to create a accredited training for anyone that wants to become a link worker in India, to kind of provide a basic framework to follow. And actually Singapore, they created a custom bespoke training for Singapore link worker. So definitely you can discuss with the UK one and Singapore one to create a dedicated version for Indian pharmacists. And of course, having an association to gather all link worker is very important. One of the reasons why social prescribing has become more and more mainstream is the shared voice for all link worker through a single organization, being the National Association of Link Worker. So you could create a dedicated one for Indian link worker, right? Now, wider determinant of health. So it's extremely important that if you're planning to do some kind of pilot in India, to embed social determinant of health into your action plan. So you could use some of the learning from Professor Mahmoud's report and maybe work in collaboration with any social determinant of health expert in India. Having them on board is going to be crucial to make this project and pilot a success. So for example, in India, in UK, there is the HLP framework, which stands for Healthy Living Pharmacy Framework, in which that was launched in 2009, which was all about the ethos of promoting health and well-being at the community pharmacy level. And then recently, it's become a legal requirement for all 14,000 community pharmacy in UK to be Healthy Living Pharmacy accredited, which is a plus point because social prescribing is a natural extension of that. So as part of this, to follow on to the HLP framework, last year there's been discussion on the Health and Care Act 2021, which is going to become in place in April 2022, which discuss about shifting the focus from delivery of services, as in you do service A and I pay you that much money, to a collaborative approach whereby if the patient improves their health and well-being, you get paid that much money. So we're shifting the model of care similar to value-based care. So value-based care is something that started in India, in America, with Kaiser Permanente as one of the pioneers. And this is going to enable pharmacists to be part of a board. In any case, they call it the Integrated Health Board, where the pharmacists have a shared voice in making pilot happen, making funding allocated for social prescribing pharmacy pilot. And I think that's something that could be looked into for the Indian healthcare system, to have like this kind of shift to trying to reduce health inequality and trying to provide funding based on the improvement of the patient health and well-being. And also there's a very, very powerful piece of document that was published in September 2021 by the Chief Pharmaceutical Officer in England, Dr. Keithridge, where he talks in his report that at least 10% of medication prescribed at the primary care are prescribed unnecessarily. And medicine has a huge burden cost to the NHS. Can you imagine 10% of these are being spent for people that don't even take it or don't even need it? And us pharmacists are ideally placed to have the clear communication with the patient to find out if they really do need that medication or whether that medication can be taken off. That is the concept of de-prescribing. And it's been shown in his report, he talks about the benefit of social prescribing, shared decision-making, and personalized care. So those three could be part of the pharmacy toolkit in India to have that conversation with the patient to find out if they really do need that medication or not. So in terms of enhancing the uptake of local asset, there's a very important organization that everyone should learn about, is the United Nations Habitat. And basically that involves directly in trying to make people-centered smart cities. And they have a very, very informative handbook as part of number 11, make cities and human settlement inclusive, safe, resilient, sustainable, whereby they want to achieve where no one gets left behind and achieve inclusive and sustainable development where the citizen can have a voice to help the laying down of the city planning to make it easier for them. So for example, an example could be, you could take maybe an hour for a patient to attend the nearest pharmacy, right? So you as an urban planning pharmacist could enable some kind of bus stop near the patient house or near the patient city to enable them to see a pharmacist quicker. So instead of walking an hour, they could take a bus that go near them to see a pharmacist with 10 minutes, as an example. Or it could be even subsidized travel transport costs, right? It could be travel costs totally free for those over 60, which tend to be the most vulnerable patient when they take the bus. And you as urban planning pharmacists could potentially help in making this happen in your city, as an example, right? So in terms of a social prescribing scheme, you need to be able to draw meaningful data out of it, right? So for instance, one of the most comprehensive report up to date is done by my very good friend, Adam Patterson Radbourne, where they talks about some of the synthesis of the community pharmacy social prescribing pilot, and some of the roadblock identifies is definitely cost, because in UK, pharmacies are being asked to do several services with no remuneration, which act as a barrier of entry for massive national uptake. And also this was resonated with the 2019 report by the University of Bath, which then again at the time, many pharmacists didn't even knew on what was social prescribing. To give you a bit of context, back in 2017, I made a phone call personally to 300 community pharmacy in London, just to kind of tell them if they knew about social prescribing and if they wanted help to try to set up a pilot. Only one pharmacy out of 300 heard the term social prescribing. That was, like nearly 5 years back. But now, thanks to the national marketing campaign for social prescribing, more and more pharmacy are aware of the benefit of social prescribing. So how could this work into the context of a pharmacist? So in a nutshell, the patient could refer themselves to the pharmacist, and then the pharmacist would refer that patient to a link worker, and then they could have some kind of digital social prescribing software to capture the referral. Then the link worker contact the patient, and then they arrange a meeting in the house. And then in parallel, the patient improvement could be monitored by the pharmacist. And then when I did discussion with Justina from the Healthy London Partnership, which is basically an organization in London which kind of promotes social prescribing, she mentioned about a social prescribing formulary, whereby the greater the improvement of the patient health and well-being, the more remuneration for the pharmacist. And I think this become a win-win-win situation. A win situation for the pharmacist to get paid for their work, a win situation for the patient because they were able to get a referral than wait more weeks, which could have caused a degradation in health and well-being, and a win for the NHS health system, right? So of course you could digitalize this whole approach, because from the book from James Clear called Atomic Habit, often you need some kind of a cue to kind of trigger you to ask the patient for social prescribing. And if you're really busy, this could be a missed opportunity. So in UK specifically, we use PMR system, which is like patient medical record, which is a computer software which has all the patient details. And when we do services in UK, when we access the patient details, there's a pop-up message that comes up, or this patient might benefit from this service. So some of the common services in UK is, for example, a new medicine service, whereby the patient that gets a new medication, the patient will have a conversation with the patient, either face-to-face or over the phone, first at day 0, then at day 7 to day 14, then a follow-up conversation at day 14, day 21. And the same line of thinking, the system could identify patients that may benefit from a social prescribing referral. And then this could come up as a pop-up message. And then the patient speak with the patient and say, actually, based from your medical record, I think you might benefit from a link worker referral. Refer them to a link worker. The link worker contact the patient. And then again, the pharmacist can get remunerated based on the level of improvement from the patient. So some of the algorithm that could help streamline the process is, for instance, have patient while on regular antibiotic, patient on income support, patient on antidepressant, or even those with uncontrolled diabetes and statin. So this could suggest that patient is taking unhealthy food, therefore might benefit from a cooking class and even exercise, right? But that is just a snapshot, because this is something I did, I believe, 4 years back. I came up with that system, but there's so much more that parameter you could tweak depending on the patient health needs into your city to make the software fit nicely into your working environment. So also going back to the social prescribing link worker, in London, they should have only up to 250 referrals per year, right? But at the moment in London, when I was speaking with Justina, she said that link workers are getting up to 900 referrals per year, which is almost 4 times the normal workload. And in us pharmacists, ideal place to be able to assist with the workload. So for example, you could have the pharmacists themselves being upskilled as a dedicated link worker, the pharmacy technician, the counter assistant, the dispenser, and even the healthy living champion, which is basically a member of staff that's been upskilled in as part of the healthy living pharmacy project, right? And if you think about it, for this to be a success, there needs to be the appropriate infrastructure in place. So for example, when we had the COVID-19 booster season last December time, pharmacies would have 2 pharmacists. So it'd be a pharmacist for the dispensary to check the patient medication, but then you had another pharmacist specifically focused on COVID-19 vaccination. So in the same line of thinking, you could have, of course, the regular pharmacist involved with the regular medicine checking and dispensing, but then have a dedicated room with another pharmacist that carrying out those consultation within the pharmacy in a dedicated room. So that this kind of allow a streamlined process of pharmacist A from the dispensary into a referral to pharmacist B, which is handling the social prescribing consultation with the patient. So in terms of leadership, pharmacy students are the future of the profession, as well as pharmacists that involved now. So in the UK, they developed the National Social Prescribing Student Champion Scheme. So this is something that could be explored in India as well, whereby you're not just involving pharmacy students, but it could be a collaborative approach between the Indian Pharmaceutical Association Student Forum Association with the medical student in India, with the Allied Healthcare Professional Student Association, or even the voluntary sector, right? So you're kind of involving different stakeholders to work under a single banner of social prescribing student scheme. And then that way you can share best practices and fasten the development of Indian social prescribing. So last year, it's been the launch of the student framework for social prescribing on the 24th of November, which had stakeholders from Japan, I believe that's the person here, Singapore, Australia, UK, and then America as well. And this booklet, Playbook, is very useful for any pharmacy student to get involved with opportunity with the Indian health system. And also I've created a pharmacist version whereby I've launched it earlier on last month, where I'm looking to create to mentor social prescribing pharmacy student as ambassador for SPA to, for example, create a webinar, to organize an event, and so on. So I invite you everyone to be part of the Social Prescribing Day, which is taking place on the 10th of March. And you can use the hashtag Social Prescribing Day. And Social Prescribing Week is actually happening from the 4th of March. And there'll be a week-long opportunity to promote social prescribing at any part of the world. And you could potentially do some kind of event in India and then use the hashtag Social Prescribing Week as an example. So there is the largest social prescribing event happening on the 10th and 11th of March. And I highly recommend everyone to check it out if you got time. And also I'm organizing, so before I play this video, so basically as part of my work, I'm working on a blockchain game called Fractal Fantasy. So I'm just quickly play this video if it works. Wait. So yes, that was a sneak preview into the game I'm working on, which is basically on the concept of blockchain gaming for healthy behavior. And basically I'm organizing the second edition of my conference on the 19th of April, which is bringing stakeholders from the Web3 industry and the health sector. And basically the aim of the event, which is totally free, is to inspire social prescribing technology entrepreneur. And as you can see, I have the blessing of having Professor Sir Michael Marmot as one of the keynote speakers. I also have Isabel Washmut from the WHO. Then, of course, I have Dr. Avi Mehra, who works with IBM to discuss about, for example, precision social prescribing. So the involvement of genomics, quantum mechanics, and artificial intelligence. And also there is a concept of space social prescribing. So I have Professor Thais Rosamano, who's a space doctor with over 30 years of experience, and she's worked with the NASA. And then you have Jury, who's basically from Bodegi, will be discussing about digital twin, which will become a very important part of the pharmacy toolkit in the near future. Then you have Aragon, who's basically the chief marketing officer for YOM, your Open Metaverse. So the video I've shown you was basically a concept where in America, you have doctors prescribing digital therapeutics application to patient. So the video I've shown you was the early glimpse of metaverse therapeutics prescribed by doctors to the patient, MTX. And then there'll be the NFT person, but I'll discuss it afterward in a different event. So that'll be the end of my talk. If anyone has any question, please fire away.
Hello, Arun.
Yes, hi.
You can hear me, right?
Yeah, I can hear you.
Yeah, a wonderful webinar, really a new concept, an innovative approach, and health is much beyond the medical records. Yes, I fully agree with you. And you explained these concepts very well. And I think everybody who was listening to you has got definitely inspired to work in this direction. And I'm so glad many of the attendees are students, and we will definitely take it up. And as you said, Singapore is also following you, and yeah, definitely we will work towards this, and we will take your help in this matter.
For sure, I'd love to.
Thank you. Thank you so much.
I would sincerely like to thank our speaker for such an amazing presentation. It was a pleasure to have you with us, sir. We look forward to working with you for any projects in the near future.
So
Also,
does anyone?
yes.
Oh,
No, it's fine.
So yeah, so if anyone has any question, because when I give lecture to pharmacy students, a lot of people ask me about the metaverse. Like, how can pharmacies work in the metaverse? How they work? So if anyone in the floor has any question on this, I'm more than happy to briefly give a brief overview if you wanted to. But any question on space social prescribing?
Yes,
metaverse,
exactly. If anyone has any question, please drop in. All right, okay. Yes.
Like, no.
Yeah, metaverse, exactly.
Okay, sure. So be ready to be blown away. So in a nutshell, I've been involved in a metaverse only recently, where I actually launched a company called Metaverse Social Prescribing. And the metaverse industry is bound to become $1 trillion economy by 2030. In the same line of thinking that right now there is a concept of teleconsultation, where you can have the pharmacist speaking with the patient across Zoom, across a 2D screen. In the space of a few years, that interaction will move into smart glasses or even contact lenses, where at a single touch, you get immersed into the metaverse, and you could have your digital twin. So you have digital avatar, which is the fun version of yourself that you use to play a game. But then you have the digital twin, which is an accurate representation of yourself, including your biometrics. You could even have like a Fitbit into your hand, and then you as a metaverse pharmacist, abbreviated with meta pharmacist, having a consultation with a patient in a metaverse. So that gives rise to the concept of a meta pharmacy. And the patient digital twin could interact with yourself as a meta pharmacist, and you can look at the reading from their Fitbit to have an accurate representation of the current health rate, blood pressure in the last 24 hours. And then get this right, that's mind blowing, because I'm releasing a podcast on Monday with Aragon. The patient, I can prescribe them medication in the metaverse. So I pick a virtual medication, like a meta medicine, give it to them, and then this will get registered into the ledger as NFTs, and the patient medical record get into, I've been prescribed paracetamol or ibuprofen by the pharmacist, and then that patient get delivery of the medication through a drone. So this is being explored right now by McDonald's. So McDonald's got patent to have a virtual restaurant where people can buy burger and they get the delivery by Uber Eats, as an example. And the same line could be done with pharmacy. And then there's also the concept of meta clinic, where the pharmacist in UK, if they do the specific qualification, can prescribe medicine. So the patient could speak with the pharmacist into the meta clinic, metaverse clinic, and then the pharmacist does a meta prescription, so a prescription in the metaverse, and the patient bring that meta prescription to the pharmacist next door in the metaverse, and then get the medication filled and then get sent to the patient home. So that was just a snapshot of the metaverse.
Wow, that was super enlightening, to be very honest. Okay, we have another question. There's someone asking, how do we put social prescribing in practice?
Okay, so at the moment, the only reason why it's working well in UK is because social prescribing is backed by government, is backed by the UK health system. So they kind of lay down the clear infrastructure to be able to have doctors doing referral to a link worker, right? Like every health system organization in the UK needs to have a dedicated link worker. So for it to work in India, there must be some kind of funding in place, because you cannot go right now and say to the pharmacist, oh, do me a referral to a link worker, because they don't have the funding and time to do it. They don't have the clean infrastructure. The only way for TC can work is to get either some kind of funding from the Indian government, because I'm not too familiar how the Indian health system works, or maybe even get social investors. So like investors that are involved with the social development of the Indian health system. So they could have some kind of business plan where they say, okay, I give you 10 lakhs of rupees, and then you need to demonstrate that the investment I give to you, every rupees invested needs to come back as a positive return. That's called social return of investment. And then if you can demonstrate that the patient that get a referral from a pharmacist or through the doctor and so on, that person end up having improved health and well-being, end up seeing the doctor less, end up being in A&E less, then that's something you can amalgamate those documentation into a report to put it to the attention of the Indian health government to scale up that process.
Right.
As an example. And pharmacists have a clear rule in that you can identify patients that might be suffering from social isolation. In UK, it's very easy to see that, but in India, it might be a different approach. So because I haven't worked as a pharmacist in India, I'm not able to comment too much, but in a nutshell, identify who can benefit from a social prescribing referral.
Right. And then we have another one. Yeah, that's it. Then somebody is asking, what is the role of PharmD, pharmacists, like specifically in social prescribing?
So definitely in UK, there is a pilot that was done by Doncaster that involve pharmacists to identify patients that might benefit from a housing referral, housing association referral. Them like, how's your housing situation? Is everything okay? And if the person say actually it's not working quite well, that pharmacist can make the referral. So that's already happening in UK. But it's then beyond that, the pharmacist rule in that is identifying patient, triaging patient before it gets worse and worse. Because remember, the patient come and see the pharmacist for the medication, and then they're suffering from financial problem, relationship problem, and then the way to speak to the doctor, that they're taking the cost to the NHS, cost to the doctor's time to say, I'm having financial problem, can you help me? To the doctor. And this could have been identified by the pharmacist before they reach the doctor, which reduce expenses to the health system, and plus increase the
gap. Right, bridges the gap. Right.
Yes.
Yes. And then
so
there's another question. Okay.
So in terms of internship, so a bit of background, just to kind of say, because India has a big place in my art. Basically, like if you could see from my slide, I said I'm a dancer. I'm actually a street dancer, and came to India in April 2014 to give a workshop for Crump at Ragwala Hall in Mumbai, and 55 people came. And that's when I said to myself, Indian dancer has so much talent. So I invested $30,000 of my own money across 5 years to increase the ability of Indian Crump dancers to become at the highest level. And this was achieved in 2019 when we had the first Indian come to the World Championship and reached top 8. So I was mentoring, So my nickname is Angel of Indian Crump. So in the same line of thinking, thank you. Thinking, I'm more than happy to take internship. So of course, right now there's no clear funding in place, but I'm more than happy to have mentees, will be mentoring you. And ideally, the best way, if I was to kind of take the learning from Indian dance and apply it to Indian social prescribing, is to have an ambassadors from each state in India, where we can create a WhatsApp channel and I can share my ideas on how you can promote the image of social prescribing. And hopefully, like with Indian Crump, in 5 years' time, India will be one of the best countries in the world for social prescribing, which is right now in India in 2013, it was one of the lowest. But then in 2019, it's number 1 out of 131 countries.
Wow.
So, yeah.
So I think, all right. Nice. Okay, so I think that's it.
And I can definitely share the slide as well to Yogi to share with the student.
All right, definitely. Thank you so much, Arun.
Thank you for the opportunity.
Thank you so much. So is there anybody else with another question? I guess that's it for today then.
Okay.
So I would, yeah, that's okay. Somebody has raised hand, but there's no question.
Mr. Rup Gupta.
Yeah, Rup Gupta.
Can we unmute him? Or?
I think so. Yeah, I've unmuted.
Hello.
Hello, Mr. Gupta. Hi.
Yes. Please send your one article on the social prescribing in our times. Please send one article on this.
Arun, actually, I got that. There is an official publication of IPA, which is called Pharma Times. So Gupta sir is requesting you, if you can send us an article about this, that we can promote it to the Indian pharmacists. That's what he actually wants to say.
Yeah, I'm more than happy to do an article, because I actually do several articles with pharmacy business in the UK, which is owned by Indians. So it's a good friend of mine. So yeah, definitely. If you tell me where I send the article, the word limit, and
perfect,
I can
sure.
definitely talk about social prescribing and potentially metaverse and space if needed. But yeah.
Got you. Okay, so thank you, Arun, for taking out your time from your busy schedule. I know you're
Exciting.
such a busy person, so yeah, looking forward to join for internship in your social prescribing and promote it in India.
Sure, sure.
Yeah.
Yes. Okay, thank you, everyone. And
Thank you
yeah, if
so
you
much.
have any more question, you can connect to me on LinkedIn or even message me, or even go through Yogi. We can then connect to us. And yeah, really hyped to have any ambassadors from different states to work together, like we did it in Chrome, but let's do it Indian social prescribing. So yeah.
Right. Yes. So thank you so much for an amazing presentation. The recording of this episode will be made available on www.ipasf.org. And please give us your feedback to ipasforg@gmail.com. Thank you very much for being so patient throughout the whole webinar. And by this, I would like to conclude the session. And do follow us on social media, LinkedIn, Instagram, everywhere, wherever it's possible. Stay updated about our recent happenings and activities. And by this, I would like to wish everyone a great evening ahead. And thank you so much for being a part of it. Thank you.
Thank you, everyone.